Hi, I'm Dr. Peter Krone. I'm a general surgeon with Lakeside Physicians. I've been here in Granbury for 22 years now.
My name is Todd Belott. I'm a general surgeon here at Lake Granbury Medical Center. I've been practicing here in the community since 2017.
A hernia is basically a hole in something that shouldn't have a hole in it. It can be a natural opening that's just gotten too big over time and allowed things to go through it that shouldn't. Or it can be a tear or a problem from a previous operation.
Hernia is often one of the main reasons people seek repair and have their hernia fixed is due to the symptoms of pain at the site. Because as the muscles are separating, they're stimulating the pain nerves, and that often causes pain. Patients will have pain with lifting and various movements, and that's a pretty common reason why they get repaired. One of the more serious things that can happen is what's called an incarceration, where the intestine or the colon get trapped in the hernia, and that leads to a bowel obstruction, or in worst case scenario, it leads to a vascular compromise of the bowel, and the bowel actually becomes necrotic, and that's when we often have to operate emergently to repair the hernia and fix the bowel if the bowel is compromised.
Certainly the most common involve the abdominal wall. Umbilical hernias and inguinal hernias in the groin are certainly the most common. Other abdominal wall hernias would be hernias from a previous incision for an open operation. Another common hernia is what's called a hiatal hernia. It's where the opening in the diaphragm, where the esophagus goes through the diaphragm, has gotten big and allowed the stomach to herniate. Those don't always need surgery. People a lot of times don't even know they have them, so that's not one to really worry about. Other hernias that certainly bariatric surgeons are very familiar with are internal hernias, basically related to rerouting the plumbing for weight loss surgery that can create openings inside the abdominal compartment that can allow internal hernias.
Actually, the most common hernia is at the belly button, and it's just a natural, or the umbilicus, and that's just a natural area where the fascia becomes very thin and allows for a rupture. The second area where it's very common is in the groin, particularly in men, because of the natural opening that occurs to allow the blood supply to go to the testicle, which is actually outside the body. Incisions are the third most common, and those when someone has exploratory surgery for various reasons that the cutting of the muscles or the fascia lead to weakening and a disruption.